Medical revalidation of Puerto Rico. Clinical questions on anticholinergic drugs. 1. A 70-year-old man presents with bradycardia and hypotension after a cholinergic crisis. Which of the following drugs is most appropriate for treatment? A. Pilocarpine. B. Atropine. C. Bethanechol. D. Neostigmine. Answer: atropination. Atropine is a muscarinic antagonist that blocks parasympathetic stimulation, increasing heart rate, and counteracting the effects of excessive acetylcholine. 2. A 30-year-old woman with motion sickness is going on a cruise. Which of the following medications is most appropriate for prevention? A. Metoclopramide. B. Scopolamine. C. Ondansetron. D. Diphenhydramine. Answer: B. Scopolamine. Explanation: scopolamine is a muscarinic antagonist that prevents motion sickness by blocking M1 receptors in the vestibular system. It is commonly given as a transdermal patch. 3. A patient with Parkinson's disease has significant resting tremor but cannot tolerate dopamine agonists. Which medication can be used for symptom control? A. Levodopa. B. Benztropine. C. Haloperidol. D. Rivastigmine. Answer: B. Benztropine. Explanation: Benztropine is a central anticholinergic drug that reduces Parkinsonian tremors by blocking excess cholinergic activity in the basal ganglia. 4. A 55-year-old woman has an overactive bladder and experiences frequent urges to urinate. Which of the following drugs is most appropriate? A. Bethanechol. B. Neostigmine. C. Oxybutynin. D. Tamsulosin. Answer: C. Oxybutynin. Explanation: oxybutynin is a muscarinic antagonist, M3 blocker, that relaxes the detrusor muscle of the bladder, reducing urgency and frequency in overactive bladder. And 5. A 40-year-old man presents with excessive drooling due to ALS. Which of the following medications would be helpful? A. Glycopyrrolate. B. Pilocarpine. C. Donepezil. D. Physostigmine. Answer: Pyrrolate. Explanation: glycopyrrolate is a muscarinic antagonist that reduces saliva production and is commonly used in conditions associated with excessive secretions, such as ALS. 6. A 60-year-old COPD patient is prescribed an inhaled medication that blocks muscarinic receptors. Which of the following is most likely prescribed? A. Ipratropium. B. Salmeterol. C. Theophylline. D. Albuterol. Answer: Ipratropium. Explanation: ipratropium is an M3 antagonist that induces bronchodilation by inhibiting parasympathetic bronchoconstriction. It is used in COPD and asthma management. 7. A patient with organophosphate poisoning is given atropine. However, the muscle weakness persists. What additional treatment is required? A. Pralidoxim. B. Neostigmine. C. Physostigmine. Answer: A. Pralidoxim. Atropine only blocks muscarinic effects of organophosphates, but pralidoxime regenerates acetylcholinesterase, restoring neuromuscular function. 8. A patient with asthma develops severe tachycardia after taking a new bronchodilator. Which of the following drugs is most likely responsible? A. Albuterol. B. Ipratropium. C. Theophylline. D. Atropine. Answer: D. Atropine. Atropine is a non-selective muscarinic antagonist that can cause tachycardia by blocking vagal tone on the heart, M2 receptor inhibition. And 9. A 35-year-old woman with myasthenia gravis is given a cholinesterase inhibitor but develops excessive sweating, diarrhea, and bronchospasm. Which of the following medications can reverse these effects? A. Scopolamine. B. Glycopyrrolate. C. Atropine. D. Pralidoxim. Answer: C. Explanation: the patient has a cholinergic crisis due to excessive acetylcholine. Atropine, a muscarinic antagonist, can reduce cholinergic side effects such as sweating and bronchospasm. 10. A patient with mydriasis, tachycardia, dry mouth, and urinary retention is brought to the ER. Which of the following is the most likely cause? A. Organophosphate poisoning. B. Anticholinergic toxicity. C. Opioid overdose. D. Beta blocker overdose. Answer: B. Anticholinergic toxicity. Explanation: the patient exhibits the classic signs of anticholinergic toxicity: mydriasis, tachycardia, dry mouth, and urinary retention. Common causes include overdose of atropine, scopolamine, or diphenhydramine. Key takeaways for medical revalidation of Puerto Rico. Atropine increases heart rate, treats organophosphate poisoning, and reduces secretions. Scopolamine prevents motion sickness by blocking M1 in the vestibular system. Oxybutynin, M3 blocker that treats overactive bladder. Benztropine, treats Parkinson's disease by reducing excess cholinergic activity. Glycopyrrolate decreases secretions, e.g. saliva, respiratory secretions. Ipratropium, M3 antagonist used for COPD and asthma, bronchodilation. Would you like a detailed